This is my psoriasis from psoriatic arthritis. Hey guys, today we will be listening to Dr. G.
Dr. G can see right away what killed Glenn Carter, without a doubt.
Ah, he's got a pontine hemorrhage. Yeah.
The pons is a part of the brainstem located deep within the base of the brain. Though it is a small area, about the size of a walnut, it serves as a vital conduit between the brain and the spinal cord. Any injury to the pons can be devastating.
Let me make sure I check that.
Dr. G's original hunch was correct after all. Glenn's heart didn't kill him. It was a hemorrhagic stroke in his brain, most likely caused by his high blood pressure.
Oh, are they?
Based on her findings, Dr. G can now reveal what happened to Glenn Carter as he left work at the Orlando theme park that Sunday morning. According to Dr. G, Glenn Carter likely suffered from high blood pressure without treatment for many years. Over time, this caused the walls of the small blood vessels within the vital area of the pons to weaken and bulge. As Glenn walks to his car after work that morning, it is likely that one of the weakened vessels begins to bleed.
Yeah, I think it started out slow. He's not feeling well. He's sensing something's wrong, and his speech starts getting slurred.
Once in his car, he calls his girlfriend, Kim.
There's no way he could have
Kept saying, "I love you." I kept saying, "Glenn, Glenn." I could hear him kind of breathing.
I think he knew. I think he knew that he was probably dying. That's why he's telling her he loves her.
By this point, Glenn might not be able to see or control the fine motor movements in his hands and fingers needed to call 911. The hemorrhage begins to affect his speech and brain function. Within minutes, as the bleeding in the pons begins to overwhelm Glenn's brain, he loses consciousness. His respiratory system fails, his heart ceases to beat, and he dies. Based on Dr. G's findings, Glenn's family now knows that they could not have saved him had help arrived sooner. A pontine hemorrhage is almost always fatal.
Even if he'd had medical attention right away, there's nothing you could have done for him.
Glenn's death also illustrates how high blood pressure can be a silent killer.
You have high blood pressure for years and never know it because you don't have any symptoms. You don't have any symptoms till it starts causing problems with your heart, or you get a huge bleed in your brain, or you destroy your kidneys from it.
I still grieve. I mean, what are you going to do? I think of Glenn every day. There's nothing that doesn't happen in my home that we don't think about him. Every day. Every day.
Next on
I'll leave this case here because the second case isn't really that interesting, but I will have another case with it. In case you guys don't know, albinism is like a pigment in the hair, skin, and eyes. Anyway, on to the second case.
Real, but I'll go and look it up. I went and consulted a textbook, and Karen matched up with the symptoms quite well.
To be doubly certain, she reaches out to Dr. Samuel Seward, an expert in this highly unusual disease.
Karen had the albinism and the bleeding in the intestines that causes symptoms like the severe abdominal pain, diarrhea that can be so bad that it's really disabling.
I thought she should be tested for this, and we drew the blood and sent it off. Waiting on the results of the blood test, I wondered, what now? What's going to lie ahead? And then after a week, Karen came into the office and I had the lab test back. She actually had hermansky-pudlack syndrome.
Hermansky-Pudlack syndrome, or HPS, is an extremely rare genetic disease. In healthy individuals, proteins act as the building blocks for virtually every function of the body, including vision, digestion, and respiration. But in patients like Karen, the proteins malfunction, impairing the body's ability to see, process foods, and breathe.
Any patient with a genetic mutation like HPS, proteins are not created normally and cause problems. Hermansky-Pudlack syndrome affects different organs of the body. It's really a terrible disease.
HPS is a complex condition, but its first symptom, albinism, is hard to miss.
If you have HPS, then you have albinism. Patients with HPS can make pigment, which we call melanin, but they can't get the pigment where it needs to be. It's not packaged correctly and transported to our skin or to our hair or to our eyes as it should be normally.
Most of the patients are legally blind.
While Karen adjusted easily to living with poor eyesight, the bowel problems that first plagued her when she was 9 years old were also triggered by HPS.
About 20% will develop what we call inflammatory bowel disease or a colitis. When you have inflammation in HPS colitis, the inflammation can be so severe that the intestines really can't work very well. And that's what causes the diarrhea.
Some people with HPS develop a colitis similar to Crohn's disease, but it's the colitis of HPS.
Karen's intestinal problems were especially severe because HPS not only caused her bleeding ulcers, but clotting problems as well.
Exactly.
In healthy individuals, our platelets clot our blood when we have an injury. HPS patients have a problem with their platelets. So as a result, it takes them much longer to create a clot and stop the flow of blood. So the HPS colitis causes the bleeding ulcers. And because of this basic platelet abnormality, the bleeding can be quite profound. It's absolutely the case that internal injuries can result in very serious bleeding for someone with HPS.
While Karen has been able to manage all of the unfortunate symptoms that go hand in hand with the disease, there is one remaining symptom that may prove to be fatal.
Most people with HPS will develop pulmonary fibrosis at some point in their lives. Pulmonary fibrosis is a chronic lung disease. If you imagine the tissue in the lungs being like a very thin membrane, that's what the oxygen passes through. That membrane gets thicker and thicker to a point where oxygen can't even pass through it anymore, and the lungs can't function. Those with HPS and pulmonary fibrosis, their normal life expectancy is 4 to 10 years after they're diagnosed.
At first, I thought that, no, this is not possible.
I was really, for the first time, scared that I might die.
A fundraiser for lung transplant.
38-year-old Karen Tillman has just learned she's been living with HPS, an extremely rare genetic disorder. Even more troubling is that as it advances, almost all patients develop pulmonary fibrosis, a terminal lung disease.
Unfortunately, there's no cure for Hermansky-Pudlack syndrome or pulmonary fibrosis.
Just 3 months after getting a diagnosis, Karen is told she is in the early stages of the condition.
When I was first diagnosed with the pulmonary fibrosis issue of HPS, they told me that I would probably be on oxygen by the time I was 45. And dead by the time I was 50.
I thought I had a lot more on this.
And I didn't want to scare Holly, but I wanted to prepare her somehow. So we sat down and I told her, I said, someday I might have to go on a ventilator. She reached over and she said, Mom, it's going to all be okay. It's one of those things you just don't dwell on. I figure the more normal I can live my life, the more normal she can live hers.
Despite the overwhelming grief that comes with having pulmonary fibrosis, there are medications that can slow down the disease.
For people that have HPS who are dealing with pulmonary fibrosis, I believe early diagnosis is very helpful. There are lots of different treatment options available.
Karen immediately starts using inhalers to minimize the inflammation of her lungs. And as terrible as the condition is, she's grateful to have received a diagnosis in time to begin treatment when it can still make a difference.
There are things that people can do to take care of themselves who have early pulmonary fibrosis. Exercise and getting vaccines that particularly protect the lungs is very important.
But given how serious her disease is, Karen finds it hard to understand why no doctor was able to recognize that she's been living with a deadly condition since the day she was born.
Hermansky-Pudlack syndrome is quite rare. I think I've seen about 40 to 50 cases of Hermansky-Pudlack syndrome in my career.
This was very upsetting, and so you just try to take your mind off of best you can and talk to her and reassure her that it's going to be okay.
Today, nearly 8 years after getting diagnosed, Karen Tillman is miraculously beating the odds.
Karen today is holding steady on her pulmonary fibrosis.
So far, it's been stable since I was 38. There's only been mild progression. Some patients faced with a difficult and chronic disease become very bitter over the years. And Karen, despite the rotten hand of cards health-wise that she's been dealt, she rises above it.
Karen has dealt with the problems she's had better than anybody I know. She just seemed to accept what she had and has done the best she can with it.
The experience as a whole has bonded us even closer together, knowing that we are mortal, that we only have a limited amount of time. You have to live each day because you don't have any guarantee of tomorrow.
Tommy is my rock. And I could not have made it through this journey without him. We just take it a day at a time.